Hi, everybody. Mike Henson here for ALS News Now and No More Excuses. Today's video is going to be an interview, the latest in my NurOwn interview series. This is a young man and his mother, which I interview his mom after interview the young man. His name is Kade Simons, 22 years old, from Oklahoma City, right down the road from me, as a matter of fact. And Kade's a really super young man, had a good reaction to NurOwn. Kade's ALS is very aggressive, however, and so one of the things we're learning about this therapy, and that we'll learn as we go once approval happens, is what the exact dosing will be. But I really feel like today's interview is going to be very enlightening for those who are into the different theories about what causes ALS. And so, um, it, really, you should stick around to see the interview with his mom because it's very compelling. So Kade's speech is a little bit compromised. So we're going to do the first part of the interview where I talk to him briefly, and then we're going to talk to his mom, and then I'll have some closing comments afterwards about some of the, frankly, misinformation about this therapy that's out there. So I want you now to meet young Kade Simons, 22 years old from Oklahoma City. Thanks. How old are you? And tell me a little bit about when you were diagnosed.
Um, I am 22 years old right now, and I was diagnosed December 10th, um, 2018.
2018, right? Okay. And you were a baseball player, right? So you
Right.
noticed a slowdown in your basically your base running times. That's how you knew, right?
Yeah. I was running home to first. Like it was in college. Everything is timed, whether it's scouts or coaches.
Right.
Um, and I was like normally a 4-0, 4-1, and then I started getting like 4.44s, and I won normal. So
Okay, tell us a little bit about your diagnosis procedure. Like you're in Oklahoma City there. Did you guys go to the local doctor or what? Tell me how you
um,
handled it.
we had actually went to the wrong doctor first. It was like
Yep, everybody
a
does.
neurologist, but like he was a neurosurgeon. He kind of tested me. It was like tested me. It was like something's wrong. I don't know.
Did they do the EMG on you where they shocked you?
Oh yeah,
That
yeah.
sucks,
So
doesn't it?
everyone's leaving, and I'm like distracted me a little.
That's
But
no, that's no, that's no
I,
problem.
so yeah, it was like a long process, kind of. We
Was
ended up seeing three doctors, but so the first it was a neurosurgeon.
okay.
He was able to be like something's up with how I tested, and, then he was like refer me to someone else. I forget his name. 99% ALS, like,
Right.
and I was like, I remember asking him, uh, have you ever been wrong? And he was like, one time in my whole career.
Okay.
That hit me. I was like, damn.
Right.
And then we went to the EMG,
Right. The EMG.
and then
Yep.
yeah, with another doctor.
Okay.
He actually did it like himself a quarter of the way into it. I can like read. I feel like I can read people pretty well.
Yeah.
I knew this one
His
is
whole vibe, his whole tone. You know what I mean?
yeah.
Yeah.
He knew, and then he gave me like the official diagnosis. Then
You went to Mayo.
third opinion. The first doctor told me that there was no way I'd get in. Like, it
Wow.
was a long waiting list, and I would
Uh,
never get in, blah, blah, blah. And then they called me back, or,
you got in the NurOwn
yeah,
trial. Do you remember your first? Do you remember your first dose? What happened after the first injection?
I noticed, like, probably three hours after that, like, my fasciculations, like, pretty much went away. Both calves, both quads,
Okay.
both arms, both biceps, triceps, back, neck, and like everywhere. And then they like went away.
Wow.
Pretty much.
Basically,
Yeah,
noticeable reduction in fasciculations.
significant,
Okay.
like noticeable.
Okay.
The first doctor told me I have fast progression.
Right.
Second doctor told me slow, and then you never really. I don't know, but
Yeah.
from what I've seen, I've self-diagnosed myself as fast.
Yeah.
Like I know I felt the most changes in fasciculations, and then over time, a few days, from like a day to
Okay.
internal strength, speaking like lips, tongue, chewing, swallowing, breathing, um, like bladder strength, and like peeing,
Like you're saying,
and
it was better, or what was happening there with this?
oh, better, man,
Better.
pooping.
Better. Okay. Okay.
Yeah, that's where the most noticeable,
Okay.
like reversal aspect. And then it stopped for, I felt good for about 2 weeks, a week
Okay.
and a half, yeah, 2 weeks with the fasciculations, and then they slowly started coming back. And
Okay.
then week 4 or 5, started to feel slower in
Okay.
depression.
Okay.
Then,
Now this was after your.
yes,
This was only after your first dose, though, right? Still. So dose number
yeah,
one.
yeah.
How about How about your result after that? What'd you notice after
Same
that?
thing,
Same thing.
same
Okay.
literally fasciculation
Okay.
gone,
Okay.
and then improvements internally and main mobility wise, it was like maintainment, but
You were
it
maintaining.
slowly for me around week 2,
Okay.
1.5 after, but then they're like pretty much gone for that first week
Okay.
and a half, and then
You were kind of riding the wave, I guess, so to speak, right? I mean,
yeah, oh yeah,
how long's it been
but
since your last treatment dose? Then how long's it been since
yeah,
injection number 3?
I think it was 3 to 4 months ago.
3 to 4 months. Okay, gotcha, gotcha.
Um, November 14th.
November 14 with your last one. Okay,
And then I stretch with 3, 4 times a week, like felt insane. Like, oh my lord,
so
like
he even saw it in you. The guy that
oh
was doing your
yeah,
physical therapy saw it in you.
oh yeah. And he saw in me after he brought it up on his own after my second
Okay, after number 2.
treatment, and I didn't even tell him. went and got my treatment.
Okay.
Like,
All right. So you blinded him,
yeah,
kind of. You didn't tell him.
yeah,
Okay.
yeah. And he brought it up on his own. Yo, you're moving. Like, I was moving around on the table, whether like
Right.
I felt better and
Mm-hmm.
um, this treatment, I feel it. I'm able to identify the improvements, feel the maintain,
Mm-hmm.
feel when it falls off, like all that, just the circulations, and like, yeah.
Cade, let me ask you one question. What would you like to tell the people at the FDA and President Trump about funding extra trial participants, about pushing this thing through quicker and getting it into the bodies of ALS patients right now? Like, you've been there, you've done that, you're on the cutting edge of ALS science. What would you like to tell President and the FDA right now?
It's $1 million question, though. Way more than $1 million. That's a priceless question.
Absolutely.
I mean, it's pretty, to me, clean cut. Like, this ALS, in my opinion, and many others, is the worst disease fathom,
Yep.
whatever the word is. Like, you can't even, I wouldn't wish it on my worst enemy. Like, and then to know that, and to look at the treatments offered for people like me,
Yep.
it's like, I understand, like, alright, it's a complicated disease, complicated treatments, but pretty, but let's just be honest, we ain't got nothing.
Yep. Yeah.
Take a pill and you may live 6 months longer. Like,
Right.
I was like,
Radicava and
well, I
riluzole.
literally laughed, like, what, damn. When you have a treatment like this that felt drastic improvements, improvements in quality of life, reversals in breathings, speaking, insane, super important things, and like as a human, as an individual. Um, like and only one human in the US is getting it right now. And we know it works. I don't know what the issue is. I don't know what this like slow play is. It's
Right.
they're not like guaranteed fatal disease. There's no treatments.
Right.
There's one that I found and I know works. And it's just we ain't got a year to wait. Like I'm not gonna be able to breathe barely, if at all, or talk to you like I am now in
Right.
a year.
Right.
There's no excuses like let's get this there's no excuse. And this way I didn't even want to do this interview.
I know
I
you
did
didn't.
this interview because this issue is way bigger than me. And because I have to do this interview. Because of the thousands and thousands of people like dying from it right now. And the thousands of people that, if this is slow play like it has been, like tens of thousands or more people are gonna die from it. So
Kandy Simons, and I'm going to bring her in now. Kandy, how are you doing? And it's good to see you.
I'm well. Good to see you too. Thank you, Mike.
Oh, no problem. So I want to just find a little bit more information from you about the process when you guys, get your side of it. Like, how did you first notice that it looked like Cade was kind of slowing down a little bit, or what was your first indication, if you don't mind?
So he had had a very traumatic right humerus injury. And so we just assumed, so I'll fast forward. So the spring of 2018, when he was still playing baseball, and he would call home and say, I'm a step slower, my bat's not moving through the zone as fast. Um, we thought, well, dang, you've been off a year and you've had a horrible injury.
Sure.
Um, he had reactions immediately after that humerus surgery because they put titanium in his arm and it started swelling.
Oh.
Uh-huh. And
Mm-hmm.
so I was actually on a trip in the Caribbean and flew back and drove up to Vail and got in at 1 in the morning, and they had to readmit him. And they finally got the swelling down because they thought they were going to have to open his arm up. We get through all that, and he and Mitchell, his dad, go back for the 6 week checkup, and everything looked great. The bone was healing, and they came home, and that next week, this real strange lump showed up on his incision. And so we called back to the orthopedic doctor, and he said, well, keep an eye on it. Could just be some old blood or whatever. And sure enough, it didn't go away. So we flew back to Vail. I mean, let me just say, I'm a flight attendant, so we can fly.
Sure.
We're very fortunate with this whole NurOwn flying back and forth to
Oh,
Rochester story.
absolutely. That's amazing.
Oh, yeah, it was a lifesaver. So anyway, we go back, they open him up, they pull out this old blood or blood clot or hematoma
Hmm.
and run tests on it. It started to show signs of infection. Now he's just had this traumatic experience with this horrible injury. And this
Right.
is around the summer of 17.
Okay.
So at Christmas, he transferred from the junior college he was at to go to a junior college in Texas and play. So now we're in the spring of 18 when Cade is playing. And he actually, he had a good season, but he could tell things were different. And he'd call back. And so we're like, well, Bud, you just had this huge injury.
Of
Just make
course.
sure you're sleeping and eating and getting your lift in. And um, so he comes home after that season around May and he says, you know what? As much as I love baseball, I'm done playing. I've had so many injuries, and my body just it didn't feel right. And he
Hmm.
had a nasal sound to his voice. He's had allergies and asthma his whole life, so we dealt with allergy
Okay.
shots, nasal infection, sinus infection. So we started him on Claritin and Flonase. And
Right,
after a
because I
month,
mean, at
nothing
this
was.
at this point, the absolute last thing on your mind would be something like this. There's no,
Oh my
in
God!
fact, there's no way, even with what I know about all this, there's no way I would ever suspect that. I mean, the kid's 22, right? So, I mean, that is amazing that this injury seems to have started this. I've never been big into like the injury kind of conspiracy, but the more I look into this, the more I believe that it's a inflammatory process that may kickstart ALS. You know what I mean? Some sort of severe injury like CTE, brain injuries for football players and that kind of stuff does seem to have a
Yes.
role in some of these things.
Well, and they
Anyway,
actually told us at Mayo that week that for whatever strange reason, there seems to be some injury that triggers this.
wow, they actually told
People
you
can
that.
actually, yes, they
Interesting.
said
Okay.
that because we were telling them about, because we were still hoping Cade was having a reaction to the metal they put in his
Of
arm.
course. Well, that yeah, that would be another potential trigger that I would think of too. That there's some talk about metals and heavy metal in the body,
Yes,
and so like
yes,
this is an interest. This is interesting to learn this because I wondered, if he was familial ALS, meaning there could be a lost family line or gene,
mm-mm,
possibly, but this is totally sporadic, and
very
he had
sporadic.
when he started telling me during the interviews that he had a lot of injuries. they started thinking, huh? And now
Yes.
with what you've told me, it's really interesting.
Well, and then it gets even more interesting because, okay, so immediately when Cade got the diagnosis in December and we had the EMG, we went to the second neurologist. We called back to the orthopedic doctor and we said, we want all this metal out. So we flew back,
Okay.
they removed all the hardware out of his arm
So he
in
had
the hopes
another
that it
major
was,
surgery, another major traumatic surgery, and he was put under,
yes,
you know,
we
general
wanted that metal
anesthesia,
out.
of course.
And so then the next month, February, was when we went to Mayo and they said that serious injury
Sure.
can sometimes trigger this. And
Amazing.
so Cade also played football and had a concussion, but he hadn't played since junior high. So he didn't play in high school or anything,
Okay.
but he had had a
Okay.
concussion. So so then let's see, we start the NurOwn trial and we're still searching for thinking this there has to be another reason. You know, we're still in disbelief,
Of course.
thinking we're gonna wake up from this nightmare. And even though no one's told us he has anything different, you know, I was kind of like, okay, well, we're going to go along with what y'all are saying, but I still think we can find alternative things that have contributed to this. So why can't we undo it?
Mhm.
And so we started seeing an environmental doc here in Oklahoma City.
Interesting.
And when you print out 20 something pages to fill out. And when he and I sat down and started from the time that Cade was a C-section baby to the time that he didn't latch on to breastfeeding to the time that when he was we had to, you know, the formula we gave him, he was lactose intolerant, he was on lactate formula, you know, just on and on. The fact that he had so many ear infections, so many allergies and asthma, and so many broken bones. And that
Yeah.
was the thing. I said, listen, we asked our orthopedic doctors, we asked our family doctors, does he need a calcium supplement? You know, we need to get a bone density scan. Why does he break so many bones? Because our other son is equally as active, which is what they said to us. They're like, he's active. We're like, well, yeah, but he breaks a lot of bones.
Right.
And so
Right.
the environmental doc said, well, I hate to tell you, but these were all signs that Cade's body was not, and I'm not going to use the right scientific terminology, but it wasn't processing nutrients properly his whole life. You know, so he said basically he was like a ticking time bomb for something like
Wow.
this. He has allergies, he has asthma, he has ear infections,
Amazing.
he has a lot of broken bones. And so, had we known that, there were things I feel like we would have done a long time ago to
Sure.
adjust, you know, because I don't know if I'm sure you've heard, but something new to me at least that's popular is this MTHFR, that everyone has this MTHFR genetic defect, that some people's bodies, you know, just like anything, some people respond to vaccinations, some people have, you know, the same medication, ibuprofen can affect people differently.
Right.
And so something about Cade's body set him up for this. And I truly believe that after going through his history with that environmental doc. And so then let's see. Even before, let me back up a little bit. So when Cade came home that May from baseball and he had that sinus infection and we started all the allergy medications and it wasn't helping anything. And so we called our family doc and he goes, we'll get him up here and, you know, I'll give him a B12 injection. We'll see if we can't boost some energy because Cade was truly exhausted, tired all the time, which also goes back to the fact that he was diagnosed with Epstein-Barr virus.
There's going to be a lot of people that find this video very interesting because it seems like he has checked almost every possible box thus far for much of the suspected triggers for onset of ALS.
Well, and funny
Interesting.
because when I started, you know, I knew of ALS. I didn't know anything about it. But, you know, they say a lot of times Lyme disease and all that.
Yes.
Well, he'd had a
Absolutely.
tick bite too. So I'm of course saying in my mind,
Wow.
he's having a line
Wow.
reaction. So anyway,
Wow.
we let me think. Where was I going with that?
You when you let's see, you went to talk to the doctor,
Oh,
and then
the
the environmental
PRP
doctor.
injection.
PR. Oh, okay.
So
Okay.
when he came home and he had all this sinus stuff going on, and nothing we were giving him was helping it. So we went to see the family doc, and Mitchell just thought he was probably tired and weak from
Hmm.
this traumatic injury. So
Right.
he had been researching PRP injections, and so we flew back to the orthopedic doctor and thought, hey, Cade still just feels really weak and is right, where he had all that surgery.
Wow.
And do you think he would be a candidate for a PRP injection? And they said, well, it's not going to hurt. So the second, I don't know, did Cade tell you about that?
No, he didn't tell me about the PRP. No, he did tell me. He did tell me
So he,
about the injury. Yeah, but not this
okay, well, so
history of
in
injuries. Yeah.
June of 18, he and I flew to Colorado,
Okay.
and he's going to get this PRP injection. And they inject, they draw your blood, spin it, and then they're going
Right.
to put this back in.
Hmm.
And truly, if he could have screamed and said the words he wanted to say, you would have heard it throughout the whole doctor's office. But whatever, when they did that injection,
Okay.
it hurt him so badly. He would have sworn that they hit a nerve. But we've since spoken to them, and they said that wasn't possible. But immediately was when Cade, it like resonated down to his thumb and forefinger,
Oh my
and
God.
he never regained the same use after that. So it
Wow.
was literally just bam. So
This is
we
incredible.
kept thinking, okay, well, if they hit a nerve or whatever happened with this in a week, you'll be fine again. And he wasn't. So 2 weeks after that, he and my husband flew to Cape Cod to watch some baseball games.
Okay.
And that was when he noticed for the first time. So this was 2 weeks after the PRP injection, that his walk, his gait was a little bit different. He didn't have
Wow.
balance like he knew.
Okay.
And so this is beginning of July. So we call our family doc again, and he orders an MRI of Cade's brain. So in August of 18, we had the MRI done, and there was nothing wrong with his brain. It was
Can I
fine.
can I can I ask you right there? Injected. Did they give him gadolinium contrast dye? Did they give him contrast dye on that MRI? Do you know? It's a
I do not know.
okay. I'd just be
Oh,
interested
oh, oh
there.
wait, no,
Okay.
he was not in. Well, you know what? I don't
I,
feel like I can say for certain.
it sounds to me like he was already well established in the path, the direction that gadolinium at that point would have only made it worse. But there is some theory about gadolinium and onset of ALS, as well. So I was
Right.
just
Okay.
curious. Do you think had he had any contrast or gadolinium before all these, like during these injuries and stuff? Do you know if he'd ever had
I
that?
feel certain that he has. Yes, with all the
Yeah.
injuries he's had
Okay.
and
Well,
MRIs,
it's
I'm
interesting.
certain he probably
Yeah.
has.
That's okay. Okay. Sorry.
And
So
so
anyway,
we
so he.
had. That's okay. So we had the MRI done. There was nothing wrong with his brain, and we're thinking, whew, okay. So now we're kind of just researching and looking at like MS or Parkinson's. What are we
Right.
starting to deal with
What are
here?
we,
We're
what's
certainly
happening? Yeah.
never thinking ALS
Right.
at
Especially at his
21.
age. Of course. Of course.
Yeah. And so then that October is who I work for. We had these tickets that they had, that were going to expire at the end of December that we needed to use, positive space
Mm-hmm.
tickets.
Mm-hmm.
So the four of us, we went to Italy. And on that trip to Rome and Venice, um, Cade started tripping and fell like 5 times on that trip. And so we knew when we got back, we're like, we have to get in to see a specialist. There's something going on
Yeah.
that's, and so that's what triggered our family
Okay.
doctor mistakenly referred us to a neurosurgeon
To a
instead of a
neurosurgeon.
neurologist, or his
Mm,
secretary did or whatever. But so when we
mm.
had to wait till the Tuesday after Thanksgiving, and that was the first time he'd mentioned, and this is how naive and ignorant I was. He mentioned a motor neuron disease, and I didn't even know that that had anything to do with ALS. I'm still thinking, okay, well, maybe so, but maybe it's not that bad. And
Because there are a
then
lot,
I started,
there are a lot of other, well, I say a lot. There's not a ton of diseases that mimic ALS, but they do exist. There are various
yeah.
versions of ALS, like PLS and other things too. Of course, MS, like you mentioned, Parkinson's, that kind of stuff. So a lot of genes we're discovering with spinal muscular atrophy are, of course, that's something infants get, but there are some relations now to the TRP1 gene and some other genes that are close in that family. So we're finding more of these genes. But 22 is so young, and so you certainly ALS would have been the last thing that you could ever believed.
Oh, absolutely. It took me months
Yeah,
to actually think that,
even consider it.
okay, maybe some of these people know what they're talking about.
Okay.
And so he knew he was watching Cade walk, and at that point, Cade had drop foot going on. And so he obviously got us in pretty quickly because it's
Yeah.
those 3 to
Got
4 month wait to get in to see a
Of
specialist. So
course. Of course.
that was on November 27th. By December 10th, we had an appointment on that day with the neurologist,
Yeah.
and he was the one that diagnosed. He said, I hope I'm wrong. I want to be wrong, but this is what I think it is. And Kate actually asked him, he goes, who's the, who, how old is the youngest person that you've ever diagnosed? And it was 34. Cade's 21. We're still thinking, okay, well, we hope you're wrong too.
Right.
And
He
so
said
then the
that too. He
next,
asked him how many times he'd ever been wrong. Which I thought was a great question.
um,
Very perceptive question for
so
that age.
3 days later, we had the EMG.
Yep.
5 days after that, we had the second neurologist appointment. We had some
Mm.
connections and friends that were helping us get in to see someone really quick. And then, like I said, in January, we flew to Vail to have the metal, the titanium removed. And then
Right.
February, we spent a week at Mayo and Rochester to have all of this confirmed again. And by March, we started NurOwn, and we just finished it last week. So
Okay.
this whole year has been a blur. I feel
Yeah.
like I've
I
done a lot
bet.
of research, but then after talking to you, I realized that I know nothing.
Well, and frankly, here's the thing: you shouldn't have to. I mean, people with ALS shouldn't have to go through this whole, as my dad would have said, rigmarole. That's a good Oklahoma word for you there, right? So, um, the bottom line is that there are the ALS has had a tremendous history of failure, right? When you say ALS, you automatically think death. That's it. No chance. You're done.
Yes.
And we're entering a phase of time now where we're seeing people for the very first time actually respond to this therapy, and some of them are even improving, which is unbelievable. And so,
So why aren't the neurologists excited about this? Because only one of the neurologists that we saw made us, and it wasn't like he gave us hope. It's just that he wasn't as depressing as the others.
well, yeah, exactly. Well, I think a big part of it is, right, if you're a practicing neurologist, if something's not FDA approved, it's pretty much dead to you at that point. There, you can do. There's a lot of good neurologists who do off-label. If something's not approved for at all by the FDA, to them it doesn't. It's just irrelevant because there's nothing they could do anyway. They can't. They could
Yeah.
suggest you for a trial, clinical trial, and many of them do. Thankfully, a lot of them did refer people to the NurOwn trial, but it took a long time to get that trial full. You would think it'd be pretty easy
And
to find
actually,
200 people, and it
no.
wasn't. You know, but it's a difficult trial. There's a lot of travel, right? And so
Yes.
that affects it. And you had the ideal scenario for that. People
Yes.
need to
Thank
understand it.
goodness.
It's about depending on where you live, $20,000 to $25,000 to get through this thing. You have to make 14 trips. We live right in the middle of the country. There were no options, except for Mayo or go west or go east, right? And so you're
Mhm.
looking at a lot of plane tickets and hotels and all that. So it's about 20 to 25,000 in some cases, for some of these people. And so, um, and then to go get a placebo. I mean, imagine people can't imagine that. So,
Mhm.
so anyway, that to answer your question is if it's something's not FDA approved, there's nothing they can really do with it. What's disappointing though is, and I've showed a video of this the other day, the average neurologist's attitude towards, ALS in
Mhm.
general. And I'll put a link to that video here so you can kind of see and people can kind of watch out there how they talk to people with ALS, and how they're talking to us now. They're saying, hold it, just be patient. Don't look at any of those people that are getting better. You be patient. We got this, right?
Yeah.
We'll handle
Sit
this.
down and wait.
Sit down and wait. And so we've said that's not acceptable. We're not going to do that. We're
Right.
not going to just sit here and say, and die when we know that people are having results. And Kade included. Of course, we don't know who's in the trial and getting real drug and not. But one thing that's obvious is that we see people that are in the trial now who are having a response. Period. End of story. I mean, we're up to over 20 now of identified people, and there's more that I've interviewed several, I think 6 or 7 now, and there are more that
Mhm.
just won't interview with me, and because they want to remain quiet, and I understand that. So there's more out there. So we see people having this response, right? And what's
Mhm.
frustrating is that if we do nothing and we just sit and wait, we're faced with mid to the later part of 2021, which is unacceptable. It's just unacceptable.
Right. 'Cause there's people don't have time to
They don't
wait.
have time. Kate is a primary example of that. I myself am. Many other people are. And so we know the drug is safe. This is its 11th year in trials and testing. It's never had a serious adverse event or what's called an AE in the trial business. And we even see people going to China and Mexico and all these other places to get stem cells that I'm aware of. There hasn't been any serious AEs there. So we know that if stem cells are done properly, there's very little risk in the process itself. When we see these horror stories of people getting them injected in their eye and stuff, look, I mean, you know, I'm not suggesting that people go to those kind of people, but there are places in the world that have kind of got this figured out. You know what I mean? They're doing these
Right.
procedures and they're actually safe. They're very reputable. And so, but that's what ALS patients are faced with right now is either just waiting to die or going to these exotic locations to try to buy some runway, right? To buy some time. And
Yes,
so,
and I think that's where you find these doctors or clinics that are willing to at least give you some shot, a chance, hope.
right,
That's
right.
what. That's where ALS patients are put.
Well,
And
and also the thing about the neurologist you said too is, in oncology and cancer, there's a willingness, there's an aggressiveness of these doctors to really go all out and to try stuff, right? I mean, the whole cancer and oncology world is totally different than it is for ALS. For ALS, the answer is go home and die. And these neurologists, they're backlogged 3 to 4 months. That's pretty standard. You said it too. And
yes,
so they just don't have time to be reading and the level of stuff that we do when our lives are on the line. They don't. Many of them, sadly, are not aware of NurOwn's success stories. They still look at this like, again, if it's not approved, it's dead to me, and it's a real shame. And kudos to the ones that did recommend people for the trial, because it did get the trial full. What's really been disappointing is their lack of willingness to look at the clinical results of people, right, and to make a statement and say, you know what, ALS is special. It's unique. We have 2 drugs right now, frankly, that are approved by the FDA that probably shouldn't even be approved. If we use
hmm
NurOwn's results as a measure, as a baseline, neither of those 2 drugs is anywhere near what NurOwn's efficacy level is, even at 45%, which is what it was in phase 2, 46. So
hmm
both of these drugs are far inferior to NurOwn, and yet they're approved. And so
yeah,
this is the problem we face is, and sadly their answer, along with our national fundraisers answer is sorry, you just have to wait. Sorry.
well, and I would say that not one of the neurologists that we saw mentioned neurone,
It's a
didn't
shame.
recommend us for a trial.
It's a real shame.
Um, I mean, the only by the time we got to Mayo, obviously they were aware of it because it was being conducted at their facility, but we still we had already done our research by then to see about the trials, and we asked about it. And actually, when we were at Mayo, which we've had, I can't say enough good things about Mayo. It's been
I've
amazing.
heard that
But
too. Yeah.
uh, they actually mentioned, we're sitting there that week and they mentioned, well, there's a waiting list to get into that trial. So we don't know where Kade would fall. And I'm thinking, I
Oh
thought
wow.
this was a super rare disease. Why is there a waiting list to get in? That's how ignorant I was about the whole disease.
Sure.
But luckily, we found out by the end of that week that they had approved Kade. I mean, granted,
That's amazing. Roberto Mugli is another gentleman who came through the Mayo trial, and I've interviewed him. And
mhm,
he states unequivocally that NurOwn stopped his progression. Period. And then you can see the interview with him for everybody watching out there. He's on my YouTube channel, and so um, we have these success stories, and it's frustrating to know that there's something right now. I mean, my body's deteriorating day by day, and I could get this drug and or this therapy and possibly have about a 50-50 chance roughly of staying where I'm at. I mean, how big is
right.
that for people out there with ALS right now to know that there's a therapy that about 46% of people that take it are called responders. Now that doesn't mean they're going to have a stellar response or the kind of response
Right.
Cade did, but Cade has a very aggressive form of ALS. It sounds like it's a very fast progressing
Mhm.
ALS, and yet it was still able to make a serious impact and a dent in the progression of
It
that
did.
disease. Talk to me about that now. He was pretty clear about it during his interview. He explained it very well. What are your thoughts about his time during the trial? How were you able to detect a real difference? And be honest, if you didn't, then say you didn't.
Uh, well, I will say so. My husband went with him to the first injection, and I know Cade's fasciculations drastically reduced, if not, stopped for the most part right after the injection. That
Okay.
night, he felt like there was a war going on with his body,
Wow.
according to what he told my husband. He had a pretty rough night, but like he said, it was only on the back
Right.
side of his
Right.
calves, the
Hmm.
back up to his neck. And but then I went with him for the second injection. He had, the nurses always say, well, how'd your last injection go? And he told them, well, he didn't have that same response the second time.
Okay.
But once again, where he was in that much pain on the backside. He did have some pain, but
Okay.
it wasn't as elevated. So, but his fasciculations once again drastically reduced. I took a picture of him where, so after the first injection, he walked out more strongly than he walked in.
Wow.
The second injection, um, by that time, I think for travel and everything, we were pretty much using a wheelchair, so there wasn't any walking in or out.
Okay.
I mean, he could walk around. He was walking around the house at that point, but not when we're out.
I understand.
And so his circulation's drastically reduced, and he did something to his leg, like just like flipped it up and over his knee while he was sitting in the hospital bed, something that he didn't just do without thinking about before. And I
Hmm.
mean, I started texting my friends and family saying there are things that he wasn't doing yesterday that he's able to do today.
Right.
But then, of course, like Kate would tell you, and he would tell the doctors at Mayo about 2 weeks before each injection, he could feel his body start weakening again.
Okay.
So it only
Okay.
lasted for him, you know, no more than 6 weeks.
Okay.
And
Well.
so that third injection, same thing, fasciculation stopped.
Okay.
He was sitting on the edge of his bed. He stood up for something, I don't know, to go to the bathroom. And I mean, he just popped right up,
Wow.
not a big deal. And
Wow.
so, but, you know, I think by that time is when, yeah, for sure. By that time, I had found you and started watching some of your videos, and I
Sure.
had seen some of the other participants, and I thought, well, Cade's re- not reversal, but
Hmm.
improvement was not that significant, even though we thought it was great.
Hmm.
So I thought, then the doubt starts creeping in. Well, maybe
Hmm.
he is getting the placebo. You just don't know.
You don't know. We can't know.
Yeah. And so, but in my heart, along with Cade's and what he told our neurologist last week when we went to the last appointment. He said that he believes that he did get the treatment
Right.
and then it only lasted a certain amount of time for him.
And so I
Yes.
find it interesting and highly relevant that you kind of saw him pop up like that. And what we've seen is there are people who claim that they're able to have a very immediate impact. And what I wonder is we do see people that seem to have noticeable measurable impact very quickly, probably because it's related to reducing that inflammatory response so quickly, and it gives the body a little breather, right? It gives the body a way to say, okay, I'm not on fire, literally eating my own neurons in here with with inflammation, and so it gives them a little bit of a breather. And that's personally my theory about how NurOwn works, and this is supported in the phase 2 data with the reduction in neuroinflammation. I believe that it tips the balance just enough in the body to stop the cascading cycle of death. It's just enough to get it over the hump. What we don't know
Right.
is for somebody like Kade, what would happen if he got 3 doses within, let's say spaced a month apart? What would have
Right.
happened if he would have got 3 doses, 6 months before that, right? I mean, we don't know that, and that's the tragedy. And we're gonna have to, frankly, we're just gonna have to figure that out as we go. We're not gonna be able to
Yes.
spend another 15 or 20 years working now on the
No.
dosing. You know what I mean? We cannot do that. We see enough of a response, just like phase 2 produced. The phase 2 results, in my opinion, are more than adequate for approval right now. People say, well, we're waiting on the phase 3 results. What we're waiting on is confirmatory data. We're waiting on data to simply come back and say, yep, phase 2 was right. That's what we're waiting on. It's almost like, arguing about where we're going to sit on the Titanic. The,
Yeah.
the ship's going down either way. It doesn't matter if you're on the
Doesn't
bow
matter.
or the stern. And so what we're doing is we're allowing people to slowly die this horrific death, waiting on the approval of a drug that eventually is going to be approved. There's no, I mean, it can't not be approved because you look at the drugs that are approved. There's nobody better. You can't show me anybody getting better on Radicava. I mean, can you imagine if this therapy had received money back in 2012 when they first asked? I mean, it's not easy to make a new drug for ALS. It's not easy to do it, and they've done it on a shoestring budget. And uh, obviously, they're on to something. As we learn more and more about stem cells, we see these other companies like Kadima Stem coming in now with a NurOwn like product called AstroRx. So there's another competitor coming in. We see HIV now a third cure based on stem cells.
Mhm.
So we start to see stem cells. We saw ALS's own words in 2009 on their own website where they said stem cells are incredibly promising for ALS, and then yet nothing was done. And so now we've spent, unfortunately, 11 years getting to this point, and they want to spend another year and a half waiting and
Yeah.
and let people see what they can't have. We see these bioethicists that say, well, the FDA hasn't approved it. It's not ready yet. They will fight to the death to make sure that the FDA's power remains complete and total over our bodies. And so we find ourselves in this very difficult situation where we have a 22-year-old young man in Kade who we see having a response. He has a very aggressive form of ALS. There's no question about that. If we get these things into people's bodies at the first sign, instead of waiting until the body's completely on fire, then it's going to be easier to control that progression early on.
Yeah,
And so
absolutely.
what we should be doing right now is the Kade should be back on the way up to Mayo for another 3 injections, spaced, I think, 30 days apart. And let's try to control
what
that
happens. Yeah.
neuroinflammation. Let's see what happens. And people are going to say, well, who pays for it? And that is the problem. I get it. But the thing is the insurance companies are already paying for something that doesn't work. And we know that volume and, mass production always brings the cost of things down. It's not, NurOwn is not going to cost 300 grand a year forever. It's only because it's such a rare bird right now. It's such a rare product. People have faith in this product, and they have faith in it because they're seeing people getting better for the first time. In fact, I want to play a video for you just briefly. This is ALSA's own VP of research on Nightline the other night. And this is what he said about NurOwn. Not me, not some crazy guy on the web, but this is what the VP of ALSA said. Let's run this video. Here.
We've seen cases where people got better very quickly, but we don't know enough to say that they actually stayed better. And so promising is really the best we can say at this point.
Okay, so you see that right there. We see people getting better quickly, right? It's an admission. It's an admission. We see them. We see you all getting better, but we don't know how long it lasts. Well, my answer to that is who the hell cares? Here's the thing. How many people with cancer would get better with one dose of chemo? I mean, we don't throw people with with kidney failure who are on dialysis over the cliff. We treat them. You know, we treat people with asthma. We treat people with these chronic illnesses by just dosing them more. We give them more product. And to hear supposedly the director of research for our national fundraiser saying, hey, we see it working, but we don't know how long it works. That is the most ridiculous logic I've ever seen in my life.
Well, I was just going to say, I wasn't even aware, like I said, I've been in our little bubble for right at a year. And to me, anything that sounds promising with the disease as deadly and devastating as ALS, oh my gosh, promising is huge.
Everything. It's not just the best we can say, you know, it's the best that we have and the best that we may have for some time. We see people getting better. Isn't that the goal? And yet with Dr. Appel, we see Dr. Appel's phase 1 trial producing the stoppage of ALS in people. Now, it was a very small trial, that's true. But let's assume for a second that only one of those 3 people had a result, which is not true. But let's assume it's only 33%. You know, we've spoken with Sharon Bradley, Larry Bradley's wife, and he stopped progressing during the course of the trial. This is the goal. This is not just something that just because it's not a complete cure, it's not worthwhile. Basically these researchers have handed ALS a way to slow or stop the disease, and it's like ALS is just throwing it in the trash can because it's not sexy. It's not a genetic cure. It's not permanent, you know. And if you thought that way for cancer, where would we be with cancer? Can you imagine going to the cancer doctor and with early stage breast cancer and him saying, "You're done. Go home. Get your affairs in order." And yet that is the exact analogy. You know, we have therapies for cancer. And in cancer, they don't do placebo trials very much. They still do them, but in ALS, they're mandatory. And until these new guidelines got done, frankly, because patients just had enough and had a near revolt, especially one in particular. But I hate to say this, but the people in charge of ALS have steered this ship into the rocks. There's no other way to say this over the last decade. And especially since, you know, the massive windfall that fell from the sky, literally, in 2014. The right decisions have not been made. We have not done this correctly. And now we're trying to correct it, and we're paying the price for it, I'm afraid to say. Now, you know, I want to bring this up, and I want to get your thought on this. I don't know if you were aware of this, but last year, we were able to, with great help from a lot of other people, to get 3 bills introduced into Congress. Okay. People say we need to be advocates. That's okay. We got conditional approval, Senate Bill 3133. We got 5497 was its companion bill in the House, and then 5480, which was a bill that was directly targeted to try to address the placebo issue in ALS, right? And so people say we need to get these things, you know, we need to be, what do they say, advocates and be aware and change the system. Well, you know, we did that last year. You know, people did that with ALS, and you know what happened is they got into the Congress and they died. Nobody would support them. This is incredible. Also would not even support bills that could bring faster access to therapies like NurOwn. This is what we're dealing with. We are dealing with I believe, a total lack of desire by those in charge to actually fix this. There certainly is no urgency. There's no question about that. Urgency and ALS don't even go in the same sentence, right? No. And so we see now patients taking control of ALS. They are tired of this crap. They're tired of this disease. You know, they are absolutely fed up with this trial. Look back here, Kandy. This is NurOwn's development process. Okay, go all the way back to 2010, and we're in 2020
Yeah,
right
that's
now.
crazy.
It actually goes back even a little further than that. But look at 2014, right? I mean, Brainstorm was asking and begging for money in 2012 to get phase 2 cooking. What would have happened if phase 2 was a large enough trial and if it were powered for efficacy? We could all be having NurOwn right now. It could be approved. And yet,
Right.
because of these mistakes, and frankly, an arrogance in our research community to downplay the role of these temporary treatments, I can assure all of you out there in research land who don't have ALS, temporary is fine with us. Okay, we don't need a cure. What we want is a way to shut this
Exactly
crap
what I
down.
was going to say. I
Go
was
ahead.
going
Yeah,
to say,
go
if
ahead.
you ask every ALS patient, none of them would demand a cure. They just want to live. They want a treatment that shows to be effective, that each day they wake up, you know,
That's right.
they're
That's
still
right.
able to do what they did the day before.
Well, and if you look at this, I want to show you this. This is NurOwn's phase 2 clinical result. Everybody's seen this. This came out back in 2016. It says they were promising. So you can see that you know, Dr. Thacker there's parroting that word. He's saying they're promising. That's the best we can say. You know, no, it's not. It's not. It's not the best we can say. It's not even close to the best we can say. We've shown people can get better or stabilize on NurOwn. It's not promising is not the best we can say. Results are the best we have right now. We have
Mhm.
results. And so I want to
One
thank
other
you
thing I
guys.
would like
Yeah, go ahead.
oh,
Absolutely. Go ahead. Sure, go
yeah,
ahead. We got all day. So
the
go
only
ahead.
thing is, no, there has to be, to me, it just seems to make common sense that you prioritize certain diseases within the FDA. They should not all have this 10-year.
Absolutely.
There needs to be a designated segment that this is fast track regardless. No one should have to fight for a fast track treatment
Absolutely.
or, like you said, the placebo effect here.
That's right. You're
You
right.
know,
The development process for ALS, the most horrific disease known to man, or one of them, is exactly the same as
yes,
it is for erectile dysfunction drugs. Phase 1, phase 2,
exactly.
phase 3, and maybe a phase 3, 3B or a 4, you know, phase 4 confirmatory trial, and safety monitoring all throughout there. You know, NurOwn has passed every safety benchmark thrown at it. It's safe. Okay, it's much safer than ALS. There's no question about that. And so you hit it right on the head. The FDA has refused to prioritize these horrific diseases above all the others. It took 7 years for the FDA just to get a new set of revised trial guidelines, meaning now that thankfully, thanks to the work of IMALS and others and our advocates, uh, whenever trials go forward now, they go forward with a different set of rules. Maybe it's not a 50-50 placebo. Maybe it's, you know, maybe it's you know, a 33%, you know, maybe it's a 3-to-1 ratio or something. But, you know, the NurOwn trial is the phase 3 NurOwn trial will be the prototypical example, I'm convinced, in 10 years of total failure within the FDA. It
Right.
represents everything that's wrong with ALS and, frankly, with big government controlled disease, you know, approval.
I
It
agree.
it represents failure at every step in the way. We have people on placebo, right? 50-50. 100 of those people had to spend all that money to go up to, you know, to Boston or wherever, and some of them couldn't even finish the trial. There were a
Right.
lot of exclusions. People, you know, couldn't breathe well enough and all that. And so
Mhm.
if you look at what the FDA required for NurOwn, it is no wonder ALS has failed for so long because it has been harassed. It has been treated with, you know, in a manner that does not equate to the disease itself in terms of its severity. And so I think we're at a turning point here, finally, where frankly, people have had enough of this. And
Right.
there are
I like
things.
your description of the Dallas Buyers Club because I've seen the movie and
Yeah, people, it's crazy. People are
people
having to
getting
go
just
offshore.
mad.
And so
Right.
patients are finally taking this into their own hands and they're finally saying, look, we're tired of dying nicely. Okay. We are ready to fight. We will not be told that that were divisive or angry, and yet some people still buy into that. But by and large, we've had a transformation in ALS over the last 12 months, where people are now, they feel okay to come out and to speak out about, wow, like this has really been messed up. Frankly, I don't know
Well,
the
it's
nice
such
way to
an,
say it, but go
I've
ahead.
said it so many times, it's such an overwhelming diagnosis for not just the person, but the family. I mean,
Yes.
the day that Cade was diagnosed and we picked his brother up from school and we're all crying, and
Oh,
you know and then you sit there and you look at Cade is 22. Most of his friends are in college or graduated, starting new jobs, getting married, you know. So the last thing he really wants to be doing is spending a lot of time with his mom and dad. And so it it's just such an overwhelming
it is.
disease that I
It is.
feel certain that someone within the FDA has. I know there's some smart people there with brain cells and a heart that would realize that this 10-year process or years long process does not work for ALS. That's just my opinion.
Well, it's incredibly frustrating. You would think that that would be the case. Yes. We went and met with the FDA last June. We sat across the table from Janet Woodcock and Peter Marks, and others met with them earlier this year. There were other people involved at even a higher level. Billy Dunn was there, and also at the time it wasn't Scott. That was the commissioner of the FDA. It was, or sorry, Stephen Hahn. It was Scott Gottlieb. Um, and they sat across from these people, and this is tragic. I wish I could tell you that the FDA gets it, but they don't. They don't. And I hope that
Is it going to
Steve
take
Hahn,
for one of them to be diagnosed with this?
I
What's it going
don't,
to take?
I don't know that that would even do it, frankly. These people
Huh.
believe in the process of government so much. And then they're backed up by these bioethicists, these people that come in. One of the bioethicists, I won't mention her name, but one of the bioethicists that we fight, and the bioethicists are people that seek to maintain the FDA's ultimate power, no matter what. They don't, they're very, they're very pro process. Again, I'll just say that. One of them was vehemently against early access for ALS therapies, and but had a picture posted on her own profile, and I thought it was so tragic. She said the picture was a beautiful family with kids, and she said, "Vote like a mother, vote like a mother," and yet
Hmm.
I'm thinking, okay, whose mother? Who are your kids? I mean,
Right.
if
How
why
would
not?
she vote if her 21-year-old son was diagnosed?
There you go. I imagine could be different, but then again, I don't know. I don't know. I wish that everybody, uh, and I'm not suggesting that we should be reckless in our drug approvals. I'm in no way, shape, or
No,
form am I suggesting that
no,
the FDA doesn't play a role, but its role is not to be the bad cop. Its role is not to
yes,
do what it's done to where we've ended up where we are now with ALS over the last decade, and that is total failure in from every aspect, whether it's trials, whether it's approvals, whether it's the wrong drugs being approved, and now we have one that's showing tremendous progress, and we can't have it. So the system has failed. I'm sorry to have to say it. The ALS system needs to be, uh, rebuilt. Rebuild. I wanted to say something else there, but I wasn't. I can't. So it's just it's in a terrible state of failure, and we've arrived, and the people with ALS right now are paying the price for the mistakes of the past.
yes.
And
One
so,
one other thing I was going to
yeah,
say is,
of course,
I I asked. I'm trying to figure out how I'll say this diplomatically, but
it's tough. It can be
someone
tough.
associated with the ALS Association, let's just say that. And I asked what is their opinion on these treatments.
Hmm.
This is someone that's married to a neurologist. What's their opinion on these treatments that are showing progress and promise? And they said, well, we are basically, like you were saying earlier, we're in the sit back and wait phase. We would like to see the results. We want to see the scientific results. And
Of
if people,
course.
this was her response, if they're improving, I would question if they were actually diagnosed with ALS. And I sat there and I thought, really? Because, and like I said, we've met wonderful people with the ALS Association, and I know there's good and bad in everything. Whether I agree with what they've
Of course.
done,
And there
we have
are,
met some very
and let's be
wonderful
clear,
people.
the people at the local levels are good people.
Yes, yes, they are.
Our concern has been 99% with the national level, the decision makers, the Neil Thackers you just saw, the Colony Bollises, the people who make the decisions, the funding decisions.
Correct.
So let's
Correct.
do be clear about that. But go ahead. I
Yes.
didn't mean to stop you
That's
there,
why
but
I was trying to be hesitant about how I worded it
I
because
understand. Yeah, of course.
uh, I thought, really, who takes an ALS diagnosis and pretends and moves on with their life that they didn't have this? You think they didn't get a second, third, or in our case, like a fourth,
Staggering.
opinion that we didn't want this diagnosis. So why would anyone question if there was any kind of improvement, whether or not they really had ALS?
Well, it's interesting that you say that because people have said that about Mark Bedwell. They've said that he doesn't have ALS, and he does. I
Hmm.
can absolutely tell you. I've spent plenty of time with that guy. You know, uh, and I've walked around DC with him miles, and his result has been it's been incontrovertible. It's been absolutely
I've looked at the
validated.
video of him sitting in
There's
the
no
room. Yeah.
question he had ALS. He has ALS. Excuse me. He always will. And but yet you're not the first person to say that. It's funny that not funny, but it's interesting you bring that up because uh, if if they're actually getting better or stopping getting worse, then it can't be real, right? It can't be. So complete is the ALS failure narrative that even when they see people getting better, they still don't believe it. And you
Correct.
saw Dr. Thacker there say, "Well, we've seen people getting better, but promising's the best we have right now." No, it's not. We have a therapy right now. We can't have it.
Well, and
I,
my thought process is, okay, well, if they were misdiagnosed and told they had ALS and they didn't, then we should be doing even more research because these people have been told they have a death sentence, and maybe if we would be working on it, we could fix what they had.
these are bridge
Right?
therapies. That's our goal.
Correct.
NurOwn is a bridge. It's a bridge to get us from here to there and to stop the dying process. We see these people who are supposed to be urgent and worried about therapies. We see them pushing back on them. Why? Why? I
Yeah.
mean, you have to answer the questions. Why are we not happy about this? Why are these people not so much as even happy about this? And you've been to the trial sites, you see the hope. You see the hope in the doctors there because they're dealing with this every day. They see people actually stop getting worse. It's incredible.
Right.
And so, but yet a lot of them also remain hesitant to admit it, right? Because they almost feel like they're speaking out against their colleagues. We're dealing with an academic community here that's very challenging. These people are very smart. They're not used to being told that they're wrong. They're not used to being wrong. They're not used to hearing the word no. And so, and they're not used to being challenged. And so, you know, we have to challenge them. That's the bottom line. To get this disease fixed, we have to challenge those who seek to tell us to go home and die. And
Right. Correct.
you doing this today, and Kade stepping up, and I know he was hesitant to do this because 22 years old. I was so worried about what kind of jeans I was wearing. I can't imagine dealing with ALS at 22.
Mhm.
It's heroic
Right.
to be willing to come out and to step up and say, look, I'm dealing with this. I know I sound, like I have ALS, and uh, but I'm willing to step up and say it because I believe in this product and I want more. And correct me if
Right.
I'm wrong
And
on
he's
any of that, but I think
no, he's still that way. At first, he was extremely private. He did not like truly. When I say we've lived in this bubble, I wasn't following, and I wasn't following you or anyone on social media. I have still not gone public with it, and I know you. I'm planning on tweeting my people that we need to tweet and
right.
knocking on their doors. But we truly, probably up until about a month ago, did I even start branching out once the trial was about to be over. We did go, I will say, in October, we went to Salt Lake City to that Healing ALS
Yeah,
conference
yeah,
that
that
to
was cool.
me was it was phenomenal. It was inspirational and
bet.
hopeful, and I learned a lot from being around that kind of a positive vibe, and it saddens me when the neurologist can't take that approach. The
Of
second
course.
neurologist we saw, um, he was the most positive. If we were going, Kate has still not gone back to see any neurologist here in Oklahoma City.
Wow.
But that
Well,
is who we would go back to see just because of his attitude, his bedside manner,
okay.
his um, promise that,
Hmm.
hey, live your life,
Right.
don't be holed up. Um, and so, anyway, I just
Well,
wanted to say that there are people out there with some promising stories, with promising treatments
of course.
that are, and it's sad in a way that it's, but I guess that's just how it is. That's how it was with AIDS, HIV. The people just have to finally say enough. We're tired of this.
That's absolutely right. And I'm with you on the. I think the Healing ALS conference is great. We have to look at all the angles in this disease. Clearly, uh, we're learning that ALS is it's a neuroinflammatory autoimmune disorder. In my opinion, it's something that gets going when the body is severely inflamed. If you have no
Hmm.
history otherwise of ALS, I don't believe that we're ever going to find a gene behind every ALS case. There are people out there that don't believe that. They think that we'll find a gene for every ALS case. I think that some of these ALS patients, like myself, maybe don't have a gene, but we have uh, a weakened mitochondria from environmental exposure, and you get that first mutation. And so, in Cade's case, it was probably all that trauma he'd had in such a short amount of time, those surgeries, those all create a tremendous amount of inflammation. And what we know about all the natural stuff is sadly on its own, it doesn't seem to be enough to quite get the body back on track. Does that make sense? It helps,
Hmm.
and certainly having a healthy body is always better than not having a healthy body. But I think what
Correct.
we're seeing is that even if we do everything possible to get back on track, get a gut biome analysis and all this stuff, if you have well established ALS, it's still not quite enough to get you back over the hump, right?
And I will say, when I was studying and researching the Deanna protocol, I'm pretty sure it was a quote that was on, like at the very front page, but basically, some doctor out of Washington mentioned and I'm going to mispronounce it, but it has something to do with with Lyme, the
Okay. Yep,
Borrelius
Borrelia
infection.
Bartonella and all those. Yep.
Yes, they
Hmm.
said there has never been a Parkinson's, MS, or ALS patient that did not have that infection.
Wow.
And so there's something going on there that, like we said, some people can handle it, their bodies can metabolize or can handle it.
That's
But
correct.
when you have several things thrown at once and your body's inflamed already,
That's right.
um, it just tips it.
Inflammation, I believe, ultimately will be shown to be ALS. I also believe that the reason that NurOwn works against ALS, the process of ALS, is that it kind of goes in there and puts out that neuroinflammatory fire. It puts out that cycle of death. Goes in there and it's capable of breaking that cycle, not permanently, for whatever reason we don't understand yet. But once that process is quote has gone through onset, whatever that process is,
Right.
uh, there's no coming back. Nobody's ever come back
Right.
from that I'm aware of. There people claim it in the reversals, like the 40 some odd reversals, but not. I'm just not convinced. Although I could be convinced, I suppose, if I would have met some of these people and talked to them. But
Have you talked to Dr. Bedlack at Duke?
well, I mean, I'm familiar with his work. Not everybody is as eager to talk to me as you are, frankly,
Oh,
but
okay.
uh, um, I've never asked. I mean, he might.
Right.
And I'm certainly familiar with his work. I'm certainly familiar with his identification of those people. And I love
Right.
his work on, he had a really nice paper about the the precursors to ALS. What field of study or whatever or work were you involved in before you had ALS? And one of them was, I noticed one of the top ones was restoring old cars. And that is
Hmm.
exactly what I did. you know. And my ALS started after I restored a couple of cars and was around that paint, all that crap, that clear coat, and
Right.
all that crap. And so again, it's all about how much inflammation can the body handle. I think in totality before this quote onset happens. Whatever onset is, I don't know, but
Right.
it's clearly a significant fatal transition in the body's metabolic process or homeostasis state that you just can't come back from, and we don't know why.
Yes.
But
Well, I was also going to say that through the ALS Healing ALS conference we went to in October, I'm not sure how it was recommended to us to watch on Netflix that documentary Heal.
okay,
And so I watched it, and that's where the medical medium shows up. So I start
Right.
looking, researching him, and he's got this celery juice, and I'll be, I have a thyroid issue, so he's got a book on thyroids, and um, but his one thing that really triggered something in me for Kate was his opinion is that the Epstein-Barr virus is basically the root of every illness. That it
there's a
is,
lot of people that feel that way.
and it just made me think, wow, because Kate was diagnosed with that several years prior to this.
Yeah.
So,
Yep. No, I couldn't agree more. There are a lot of people that really feel that the EBV, that the Babesia, the Borrelia, Warren Osborne is a super smart guy that lives in Utah. He was at the conference, I think.
yes,
He's a very strong believer in that theory, and I frankly I cannot argue with the results of the Madrid conference. Or Madrid study. There was a paper I saw recently that came out and kind of validated those results. And again, that study found that all 11 of those patients had extremely high levels of about 3 to 5 different pathogens, whereas the control group did not show that level of infection. And again, this was not blood sample, this was actual tissue sample from inside the spinal cord and the brain. There's no way that stuff could have developed after death. They were living with this stuff, right?
right,
And so those things, we know that those pathogens and those bacteria and those viruses, they create encapsulation around them. They can lie dormant in your body for a long time. They're almost impossible to get rid of. I hear rap music going in the background, so I know I probably
I was
I've,
wondering if you
I've
could
kept
hear
you
that.
way too long, and I want to really say
Not my rap.
thank
The
you.
boys are in there.
They're in there jamming out. Well, let me say that what Cade did today is heroic. I want to thank you. I want to thank him. I can't wait to meet you guys. We only live 2 hours away, and it's just been a very large learning process for me today to talk to you. And really, I learned a lot from you today as well. And so I want to say thank you very much. And
Thank you for sharing our story, and I will continue to watch all of your videos. So,
let's keep
because you
fighting. I think
had
we're getting
some
there.
information that, like I said, I thought I was doing some research, but you know way more about
Well,
it than I do.
I'm lucky. I don't have young kids at this point, so I can literally afford to spend 8 to 10 hours a day working on this. And I wouldn't do it if I didn't think we were close, that we could change
Right.
this. And we're getting there. We're getting there. Slowly,
Well,
people
we
are
depend on
realizing.
you for that research. So,
Well, thank you very much. You're very kind, and I want to say I'll talk to you later. And let's meet sometime. I want to meet Cade, and you only live 2 hours down the
He'd love
turnpike,
it.
so
No doubt he would love it. I told him
awesome.
how much he was going to enjoy talking to you, and I said, "Hey, next time Mike goes to DC, you need to just go with him." So,
Well, I'm glad somebody feels like that. So thank you very much. I'm gonna.
all right, thank you. Have a good one.
Okay. All right. Thank you so much.
Bye.
I want to thank you for watching today, and we look forward to seeing more of you at No More Excuses or ALS News Now on Facebook and YouTube. Thanks for coming by and watching this video, and I hope that all of you are doing well during this time of crisis. Again, my name is Mike, and thank you for watching.